How much is kidney transplant? Every time I have a new Facebook friend, especially dialysis patients, always ask how much is a kidney transplant? What hospital is he going to? What if there is no donor? What if there was no money? Is there really money show? We're just poor, how about that? Kidney transplantation is the most effective way to prolong the life of a person with kidney failure. But hema and peritoneal dialysis can help to prolong the life of the person. The quality of life that kidney transplantation can provide is a good quality of life. The patient's kidneys will regain their physical strength and vitality. How much is kidney transplantation in the country? There is no accurate cost data for the patient. It depends on the physical condition of the donor and recipient. Laboratory, procedures, and medical clearances are based on the overall health condition of the patient and donor. Need show money? It is only necessary to have a bank certificate show the patient is financially capable. How much? The social worker will give you a price only. I have PHP 200K for living related donor, family, relatives, friends. Without donor PHP 500 to PHP 600K for cadaver kidney, healthy brain dead patient with consent to harvest organs through family or organ donation card holder, under HOPE. The value of a bank certificate depends on your social worker's assessment. Why? This is to make sure that they are able to provide the medicine and laboratories before and after the operation. In the event of an acute rejection, the patient will have to pay. We can only afford the PHP 200K bank certificate in the first place. Monthly cure for post-transplant surgery will be provided. The first 3 months of maintenance meds are estimated to be 50 to 100K monthly, and it will decline depending on the results of laboratory tests. No donor? In fact, I also don't want to smile if no donor to family or friends can go and inquire at the NKTI Human Organ Preservation Effort, HOPE, or the DOE Philippines Network for Organ Sharing, PhilNOS, and ask how queuing process for cadaveric kidney donation. PhilHealth Z Package? PhilHealth is under Z Package answers the PHP 600K peso transplant expenses of a patient. This is only for low-risk patients. The definition of low risk is detailed in the picture. See pictures for details. A patient who needs a kidney transplant must also have 45 plus 5, 50/90ths, PhilHealth benefits. In short, 40 of her PhilHealth sessions will be used on dialysis, and the remaining 50 sessions will be used to avail the Z Package kidney transplant benefits worth PHP 600K. Also called NBB No Balance Billing Policy for indigent and sponsored patients. Just look at the pictures below for kidney transplant costs as well as requirements for Z Package. These are data from NKTI, PGH, and Cabrini. For more details you can go to NKTI every Friday except holidays for pre-transplant orientation, 8:30 a.m. for brighter details of kidney transplantation. It is free and anyone can attend. National Kidney and Transplant Institute. Disclaimer. I am just one of thousands of dialysis patients who are also looking for a kidney transplant. A transplant workup. I still undergo dialysis. The information here is based on my collected and experienced information and events. Any changes in price or requirements have nothing to do with it. Read at your own risk.